So, we still have some homework that is due. From last week, you still have dosage calc that can turned in on a case study on the musculoskeletal with a minus 10% deduction. If you want to get that in, it's still available. And then this week, we do have discussion question. Just tell me about your experience here in class. I don't need any references or any of that. It's just telling me, how was your experience? Of course, the case study, and then that HESI practice exam. The assignment exam is done, it's gone. There's no way I can open it. So you only have the practice one that's left, and it's really good for the HESI. Now, I am giving a HESI review. I call it HESI Q&A. It's going to be done tomorrow, 2 p.m. Yes, it's going to be recorded. Yes, I will post it. But it's a great thing to listen to, minimum of just listening to it, because it really starts to help you think how to take a question. What is the best answer for questions? Looking at the growth and development, what are type of things you need to remember about them, because there's so much, right? So how do you focus it in on what you need? Well, this HESI Q&A brings it in really tight for you. So yes, it's already posted in my YouTube channel, some previous ones. I've updated a little bit, and I've actually put in some more concepts from last term's HESI, making sure that they're covered into this HESI Q&A. So slightly different, not much, but a little bit there is different.
I have a question. Is it okay
Sure.
if we join on and keep our cameras off? Or do we have to
With
have our
it,
cameras on?
with the Kahoots, you can turn it off, but when I come
No, I'm
on, you
talking
can.
about with the HESI review.
Oh, you don't have to have the camera on
Okay.
during the HESI review. Only during class, my dear.
Okay.
Okie doke. So I've got two different HESIs I can give you. Now, you still have almost an hour and 20 minutes left of class. I can give you a 48 question Kahoots, HESI. Also, I have 100 question Kahoots. What would you all prefer to do? And I know it's week 10. I know you've been in exams all week, and I know you're exhausted. So should I guess for you? Probably.
100.
You want to do the 100 one? Who else? 100 ones? All right, we'll go as far as we can. How's that sound? All right, let me pull one up for you. Let's do this one. Now, you do have both of these posted, okay? I will post the 48 question one because, again, it's just another review of all of the stuff that you're all going to need to understand about for the HESI. Where did it go? I had you right here. Nope, that's not the one. I want this one. Now, these Kahoots I have made, and I'm telling you, they're coming right directly from concepts that I have seen on your HESI. So if you see a question regarding growth development, about intussusception, or you're talking about things like tumors and, Wilms tumor, do I touch it? Do I biopsy it? Those are sort of questions that you're going to see here, and I'm going to keep repeating them. Remember, I don't look at who plays the game. I don't look at who gets questions wrong. These are things for you to help you study. I'm showing you what concepts that you need to look at more by looking at these Kahoots. Nobody more wants to join me today?
I'm trying. My computer's just slow.
Okay. All right, we'll get started so we can do as many as we can go. And when you're all done and you've had enough, guys, just let me know. We can stop at any time as long as we've put enough time in class. What is probably the single most important influence on growth at all stages of development? You've heard me say this before, and usually I say it 3 times over and over and over again. So nutrition, nutrition, nutrition. We know that with a newborn infant, if we're not feeding them proper nutrition, we're going to see it in many different ways. Growth and development, cognitively, they're not going to be where they need to be. And of course, it's going to be that scale. The scale's not going to show the weight gain. It's the reason why we do height and weight on every child all the way through to age 21. We want to make sure they're growing properly. How would you initially treat a 6-month-old infant diagnosed with GERD, gastroesophageal reflux disease? How do you treat it? What is GERD? It's that spit up, right? What's the problem with spit up? Well, if you're spitting up every feed, you're losing nutrition, nutrition, nutrition. So we need to keep that nutrition in that child. And all we do is put a little bit of rice cereal in the formula or the breast milk, and it's actually 1 teaspoon per 1 ounce of milk, whatever the type of milk it is. And let me tell you, it does work. It thickens it up just enough. During an assessment on 2 months old, you notice that the head circumference has increased 2 inches. The next action to take, what do you do next? The head circumference has increased 2 inches. So the problem with the head getting big, and we always measure it every single assessment, is to make sure a child does not get hydrocephalus. The other way to look for hydrocephalus is looking at that fontanelle. Dehydration is sunken. Hydrocephalus or some sort of head injury would be a bulging fontanelle. So yeah, that fontanelle is pretty neat to look at for infants. Frequent developmental assessments are important for which reason? Why do we need to know if they're rolling over, if they're grasping things, if they're able to move it hand to hand? Why do we have to know that stuff? We know that children are predicted to do certain things. And if by a certain date they're not doing it, there's a problem. Whether it's a cognitive delay, maybe it's nutrition that's delaying that cognitive growth, but we need to make sure that our children are growing the way that they should. And if not, what do? Well, that's when we look at nutrition and we look at introducing early intervention. Physical, speech, occupational therapy. And the great thing about kids is they catch up really, really quick, usually. A multi. An infant just received their 2-month set of immunizations. Discharge teaching should include what? Remember that 2-month set of immunizations, like 4 different immunizations, isn't it? That infant at 2, 4, 6 months gets a whole bunch of them because that's the big bad diseases, as we call it. And we don't want them to get it because they don't have an immune system to fight it. Now, what happens when we give immunizations? The body tends to respond to it, and the body then makes antigens to protect themselves. Sometimes there is redness, there's pain, there's swelling, there's heat in the injection sites, which are usually, your vastus lataris on either side. They usually put 2 on each side. So when we get these children home, if you bicycle their legs, that's moving the muscles. That is getting that immunization, all of that liquid moved around so it's not as irritating. Another thing is giving acetaminophen every 4 to 6 hours as needed because they're going to have low-grade fevers. We expect it. Sometimes they get red and painful and they hurt. So they need some acetaminophen. And that's all we can give them right now is acetaminophen for that pain or that fever that goes along with them. And then putting on that nice, hot, inflamed leg, a nice little cool pack, actually helps with the discomfort also. We expect a fever, you don't have to call the doctor. No. The head to tail direction of growth is referred to as what? What's another word for a head? It's called a cephalic, right? So head to toe, caudal. So head to toe, cephalocaudal. What is the single most important factor to consider when communicating with children? We want to know, where are they? Are they cognitively aware? Are they delayed? Because if you're talking to them and they don't understand, you're not getting anywhere. So get on their developmental level. What 2-year-old child pain assessment tool should the nurse use? Remember, we've talked about faces, FLAC, we talked about numeric. I mean, Oucher was mentioned, but it's usually those other three that we hear about all the time. So when you are less than 3 years old, or if you are nonverbal, you are a FLAC, which is faces, legs, activity, crying, consolability. Okay, it shows us how much pain you're in. Once you get to be 3, and you can go all the way to adolescents and adults if you want, faces scale can be used. We use that numeric, your book says, at age 8. A child requires ophthalmic ointment to be applied to the eyes. What teaching should the nurse give? What teaching you need to give about ophthalmic ointment? We usually use that for conjunctivitis, right? And it doesn't matter if it's a child or an adult. You put ointment in an eye, it's going to cause your vision to go blurry. A child or even an older person, when you put that ointment in and you see blurry, it's going to see that, oh my God, I can't see anymore. I'm all blurry. And that will make them nervous. So warn them first before you do it. According to Erickson, school-age children having a prolonged hospitalization should be offered what to promote industry? What is their industry? It's their factory. It's their product, right? Something they do well. That's the way you have to think of that question. So when we're offering something to a school-age child, it could be they need something to keep them occupied. They've been there a long time. And let's say we give them a puzzle. You wouldn't give them a 2,000-piece puzzle. That's ridiculous. We need to get maybe a 500-piece or a 250-piece puzzle, but something that with a little effort, they're able to complete. Don't ever give them something that's too difficult for them to complete, because then they get into that inferiority. I can't do it. And they always want to do the industry, what my product is, what I do well. So that's why we'll offer something they can do. What is priority treatment for a child with dehydration due to profuse vomiting? Child's vomiting, what are you going to do? Priority treatment. So priority treatment for dehydration, because kids do not tolerate being dehydrated. So if they have profuse vomiting, that means nothing can go in their mouth. They'll just keep vomiting it, and maybe they'll aspirate. So IV fluids. Remember, when we draw and put in that IV, we're going to be drawing some lab results, and we do need that basic metabolic profile. That tells us where we're starting at. How bad is that dehydration, okay? Will we maintain them NPO? Yes. Will it be 6 hours? Probably does not have to be that long. We'll be given antiemetics and we'll slowly introduce a little bit of oral something. The first expected fine motor development milestone for an infant begins with what? What do they do first? Fine, fingers, right? Fine is F fingers. What do we do first with our hands? And that's the reflex palmar grasp. That's when mommy puts their finger in and the infant hugs it. And they go, oh, look, my baby hugged me. Please don't tell them it's the reflex. Let that mother think that that baby knows who they are. Give them that moment, okay? Just shh, don't tell the truth. You're not lying. You're not saying anything. An 8-month-old infant should be expected to perform which fine motor skills? What an 8-month-old should be able to do with their hands? Remember, it starts with that, reflex grasp, voluntary grasp. Then it goes to crude pincer, fine pincer, putting things in containers and building a block of two. That's the first year of life. So, about 8 months, they should be able to grasp that rattle and they should be able to take those little puffs or Cheerios out of their little high chair and smoosh them in their face. We call that crude. Later on, they do it one at a time and they very carefully, neatly take them. But at first, that's what's crude. They sort of smush it in their face. They don't have that fineness yet. In general, an infant should triple their birth weight at blank months of age. 12 months old, they should triple their birth weight. Now, what if they're too much or they're too little? Well, that's why we look at that. We can give more something to eat, or why are they too little, or why are they too much? Let's do a diary. Always, what did your child eat yesterday? Always with anything that has to do with weight, too much, too little. How do you do your investigation initially? Food diary. What are the children eating? And from that, you can figure out what you need to do. Aaron is assessing a 2.5-year-old toddler, should report which finding to the provider, as in which one here is not right. And this one could be a little tricky. At birth, an infant's head is bigger than their chest circumference. By about a year and a half, they should be the same, or the head should be bigger, less than the chest. Okay, it changes. So by 2.5, absolutely, the head and the chest, there shouldn't be a bigger head out there. And if there is, we need to tell the doctor. Now, they do quadruple their birth weight by 2.5. So that's normal. And yes, they do gain about 3 inches a year, which is absolutely normal for a toddler. And we know all of those fontanelles are closed by a minimum of a year and a half. A mother of a 3-month-old infant is concerned because the infant's head is flat in the back. How are you going to respond to her? The infant's head is flat. Isn't that all about back to sleep today? We don't let those children go on their tummies anymore, do we? It used to be watching a baby sleep on their tummy is where we always put them, but we found SIDS deaths was increased because of it. So when we have an infant, we know their heads and their scalps are very soft. If we put them on those little tummy times on their abdomen when they're wide awake, that gives enough time for it to round out, believe it or not. That's all they need to do. Tummy time. A 2-month-old infant has cradle cap. What should the nurse tell the parents to treat it with? Cradle cap, that white crusty stuff in their scalp, right? So you wash the hair normally, soap and water, some sort of moisturizing oil or cream, baby oil, mineral oil, one of those we put on, and then you comb it with a fine tooth comb very gently. Now, it's not going to go away the first time. It might take a week or two, but very slowly you'll get rid of that cradle cap. What information about introducing solid foods to their 6-month-old infant would you offer? I guess parents are asking, when can I feed my kid? When can you feed them? How do you feed them? So at 6 months, we start introducing food. We introduce one at a time every 4 to 7 days to make sure there's no allergies to it. We know we start whole milk at 12 months. Honey is not offered till 12 months also. According to Kohlberg's pre-conventional level of moral development, a preschooler who has moral reasoning. Kohlberg, remember who Kohlberg is? Morality. That's rights and wrongs, right? What does a preschooler understand? I think you can put it down to the words of reward and punishment. But again, there's consequences that are good and bad, and they both have whatever consequence, a good consequence or a bad one. And we know preschoolers know that as reward and punishment. Which nursing action is appropriate to teach a preschool age child about a scheduled procedure? Preschoolers ages 3 to 6. They're going to go for a procedure. What are you going to do to them? They like a visual. Give them a doll. Let them play with it. Let them touch the equipment. It makes everything less scary. If a child knows what's coming next, they're more apt to tolerate it and not be so scared about it. Before performing a physical assessment on a toddler, the nurse should do what? To encourage cooperation. So a toddler, ages 1 to 3. You need to go in and do an assessment. How are you going to do it without that kid screaming and yelling and clinging on your mother? Well, again, you first of all, you get down below them, not towering above. You get on their developmental level, and then you let them play with the equipment, touch it. Whether it's a doll in there with you too, whatever it is, involve the child, and they do so much better. In terms of language and cognitive development, a 4-year-old child would be expected to do what? Cognitive, Piaget. What does he say? Four-year-old children. And I'll tell you, abstract is always your adolescent. Okay? 4-year-olds, they follow simple commands, which means, could you please take your laundry and put it in the dirty laundry? Could you go get your jammies? Let's go take a bath. Put your shoes wherever. I mean, these are things, simple commands that preschoolers, that 4-year-old can understand. Parents are concerned her 8-month-old child's not developing like their older child. What is normal for an 8-month-old infant? What should they be able to do? So at 8 months, they should be able to sit alone unsupported. Pulling them up to sitting position, that's almost up to 9, 10 months. They need a little bit more for that. They are putting blocks into a container at 11 months, and then blocks, tower of 2, that's 1 year old. An infant presents with signs of dehydration, hunger, and an olive-sized mass in the right upper quadrant. What would you monitor for? What do you think is going on? Which condition has an olive size mass? That right upper quadrant, I call it right below the xiphoid process. I call it a marble. It's pretty hard. And this is the pyloric sphincter is hypertrophic and enlarged, and that is that olive that they are feeling, that little marble. With projectile vomiting is pyloric stenosis, and that's what the answer to this question is. This was understanding. It's an infant. This is the olive size mass that's specific to pyloric stenosis, and it's the right upper quadrant. A multi. What would alert the nurse to hold the digoxin on an infant she's caring for? So, digoxin, whether you're an adult, whether you're a child, is going to be the same things we look at. Now, an infant's heart rate's going to be different from an adult. That's the one thing that is a difference here. So, an infant's heart rate of 90 is a little too low. So, yes, we would hold it, call the doctor. Digoxin level, I mean, it doesn't matter what age they are, that's an elevated dig level. And we will always look at potassium level, making sure it's at least 3.5 or higher. And one of the things, and might be the only symptom we have about digoxin toxicity in an infant, might be that they're vomiting. So, an infant who's never vomited and now starts vomiting, you can suspect digoxin toxicity. Hold the dose, call the doctor, get an order for a dig level, and take it. And then, if you can, administer the medication. When taking an adolescent health history, which is most important? How are you going to get a health history on an adolescent? You know, many adolescents will not talk in front of their parents. I mean, I wouldn't say nothing in front of my mother because I would be restricted for life. And I understand that. So I have adolescents that I've taken care of. I do ask the parents to leave. Now, I don't have to tell the parents what that child said unless the information they gave me is going to hurt themselves or others. Okay, that's the only way that I would tell them anything about it. A multi. A 13-year-old status post-umbilical hernia repair is complaining of abdominal swelling, severe pain, and vomiting. What could have caused this? We've had a hernia repair, and now the tummy's hurting. What do you think's going on? Well, what is a hernia? A hernia is when the intestines start popping through the peritoneal cavity, right? A lot of times when they're doing hernia repairs or if they do a surgery on the kidneys, they go directly down in through all the intestines. And many times they end up with a paralytic ileus because of the amount of touching and manipulation of those bowels, those intestines. So that is absolutely a common occurrence that can occur. So we get them up and moving, get gas moving as quick as we can. A 4-year-old is reluctant to take medicine. What intervention should the nurse take? How are you going to get her to take the medicine? So 4-year-olds, they tend to be a little bit reluctant and a little bit stubborn. So how are you going to get it into them? Well, I would offer them, do you want a liquid? Do you want a pill? Do you like the red liquid or the orange liquid? Do you want it in a syringe, a cup, a spoon? I mean, we can make it whatever they want. So give them exactly the information, let them make a choice, and then of course you have to assume that they're going to take that medicine. Which concept reinforces the development of a sense of trust for an infant? Trust. Erickson, what's that all about? When you have an infant who is happy and they trust, according to what Erickson's saying, what they're telling you is Erickson's all about the people around them that are interacting with them. They know they trust because when they call out, whichever way they call out, crying, cooing, banging, somebody comes, somebody picks them up, somebody changes them, somebody feeds them. So they're every need that they want is always being met. They can predict that, and that gives them that comfort. A child who is in mistrust is that child who's not picked up regularly. I'm not saying one time, I'm saying most of the time they're not picked up. We see this a lot in houses with drug or alcohol abuse or regular abuse or even homelessness at times only because of the situation. So we want trust for our infants so they're happy, right? An infant is NPO and is unable to take breast or bottle for feedings. What's important to remember about this infant? Their NPO, their condition, is telling they can't eat or drink. So what do you have to remember here? Remember, infants, they explore the world in their mouths and they also decrease their stress with their own mouths. So give them that pacifier, that non-nutritive sucking device, right? When teaching sex education and contraceptive for adolescents, which should the nurse consider? The thing about teaching sex education and contraceptive for adolescents, our job is we can give written and oral information, not our opinion. And that's what we tell you. When teaching sex education, it's only in written and oral form and only what's facts and not what we think they should do. The monthly immunization for RSV is respiratory syncytial virus. What do we give for that? Monthly. Remember, it's only the first year of life, from winter to early spring. And it is called Synagist, okay? You're going to have to know those names of those meds. An infant with hypoplastic left heart is becoming tachypnic, taking a long time to eat, and is requiring rest. What assessment is priority? What do you need to look at? What's going on here, do you think? A hypoplastic left heart syndrome, probably the most severe of all cyanotic congenital heart defects. They don't have a left ventricle. There's not a pump in the heart. So when we are seeing a cyanotic heart becoming more and more tachypnic, okay, that means they're getting really breathing difficult. They're taking forever to eat. They're tiring out. They need rest. This is probably going into heart failure. With heart failure, you're worried about fluid in the lungs. So auscultate the lungs next. When doing an admission on an infant with a low-grade fever and a loose cough, what information is priority for placement? So I guess you need to put this child in the room on your unit. So you have an infant has a fever and a cough. But what else do you need to know in order to get them in the correct room? The biggest thing is immunizations. I mean, a loose cough, a fever could be as simple as just an upper respiratory, but it could be something like pertussis. And if they haven't been immunized, that could be one of the probable things that it could have. So, biggest priority is to know, are your vaccinations up to date? big, big thing about patient placement is immunizations. When administering antibiotics for a child with pharyngitis, what should you monitor? Giving a child an antibiotic for a sore throat, what do you need to monitor? You got antibiotics, so it's a bacteria, right? Antibiotics are a bacteria. So you might monitor white blood cells if they are in a hospital sort of thing. But when we're talking antibiotics, remember children, they really don't get a lot of them as young children. And it could be first dose or even a last dose of a medication that can cause allergic reaction up to including anaphylaxis. What other things do we see with antibiotics that should be part of a care plan? Remember, antibiotics cause a lot of GI upset, nausea, vomiting, diarrhea. So we should monitor for that. Do we need to give antiemetic? Do we need to give something for diarrhea? Those things. That's part of giving antibiotics to kids. When teaching a parent of a newly diagnosed child with ALL, what are early signs and symptoms of an infection? And what we tell any immunosuppressed child, it could be sickle cell, it could be leukemia, it could be cystic fibrosis, it doesn't matter. Any child with an immunosuppressed disease who has a fever of 100.5, they need to call the doctor. Most likely they'll place them on an antibiotic because they don't have an immune system. So fever and an immunosuppressed child is a big alert. Let's get this kid on some sort of antibiotic now because they don't have any support to fight it themselves. A 3-year-old's brought into the ER with increased wheezing for the last 2 days. The child is using an MDI. What information is important to know about that? They're not breathing well. It's getting worse and worse. They're wheezing. The child has an MDI. What do you need to know? And you need to know, did we use a spacer? You know, some people can't chew gum and walk, right? There are even adults that can't squirt and inhale at the same time. Children, especially, 3-year-old. Let's give them a spacer. Let's put that mask on, insert the MDI in that spacer, and then they can inhale the medicine and they'll get the whole dose. I'm gonna die. What is included in the plan of care for a child with cystic fibrosis? Cystic fibrosis, remember there's 3 different things it affects, right? It affects lungs, it affects nutrition, and it affects the skin with all the electrolytes coming out of it, right? That's 3 things. Children with cystic fibrosis do not like fat. So fat is a very high calorie component of nutrition. So we have to increase the protein, high carbohydrates, low fat. This is a child who loses salt like crazy. So we will never put them on low sodium diet. Because of their lungs, they're going to be getting aerosols, they're going to be getting CPT before meals, and we'll be cleaning their equipment out every day, right? Because of all that phlegm they have. And then because of the nutrition, their pancreas does not supply enough enzymes, so they don't digest fat. We will be giving them pancreatic enzymes with meals, before meals, not after meals. During meals is when we do it. Which information is most important when rheumatic fever is suspected? So rheumatic fever, just like acute glomerulonephritis, are both caused by a strep infection that was not treated or was not completely treated. A multi. What are some assessments that an infant would have if they were in acute respiratory distress? Infants. Now, adults, children, they're a little different. Infants have a couple things specific to them. And if I see them, I'm telling you, I get scared. I bring that child right into the trauma room because I know they're in trouble. So you're going to be seeing the tachypnea and the tachycardia and the retractions, but infants, nasal flaring and a grunt at the end of every breath. And when you hear in that nasal flare and you hear that at the end of every breath, you're in trouble. Make sure you get the doctor in there quick and you get some respiratory treatment in there quick. What is the purpose of giving indomethacin to a neonate with a patent ductus arteriosus? Indocin and a PDA. Why do we do it? So indomethacin is to help medically close a PDA. Now, there's some medicines you need to know. You need to know prostaglandins, you need to know Synagist, and you need to know indomethacin. You're going to see them on the HESI, guaranteed. So if you got them all confused, write them down and make sure you know which one is which. Indomethacin is a medicine. It's actually an IV NSAID that we give, and it will close the PDA. Now, how do we know the PDA is closing as we're giving it medicine? The murmur gets less. There's a loud washer machine murmur. You see it get less and less and less, so the murmur goes away. How do you get an adolescent to open up about their sexual history? So adolescents, number one, let's get those parents out of the room so they can be a little bit more honest. And the other thing I do is, when adolescents come in, we know that we're going to have to ask questions. So we know we have to sort of, get some sort of bond or something that we can open communication with. If I see an adolescent that's wearing, let's say, a baseball cap or a team jersey, I'm going to ask them about it. Or if they have really cool sneakers on or whatever, or listening to music, I'm going to ask them what they're listening to, or if they like the Yankees, or they like, the University of Miami, or whatever it is. And that actually makes you less threatening. That's about asking about the social life. That's what I mean by that. What is the greatest risk factor for a newborn receiving a cardiac catheterization? So, cardiac catheterization is those big two catheters in the right femoral artery and vein, and they're big catheters. Our biggest concern is that once we get them out and we put a clot on it and it stops bleeding, with all the movement, it opens the clot and it bleeds. And it bleeds very, very, very quickly. So, again, we're worried about a hemorrhage from where those catheters were in that right groin. Which symptom exhibited by a 3-year-old child with croup is a priority concern? Priority, croup. What would you be concerned about? And then I'll ask you, what does croup turn into if we don't treat it? Epiglottitis, right? And when you think of epiglottitis, it's all about swallowing the secretions because now you cannot get air in here at all. Okay? That's what that question was about. A child goes to the ER with respiratory distress. They're anxious, leaning forward, and they are drooling. What action is priority? Again, what is that? That drooling stuff. That's a big sign, one of the biggest symptoms. A tripod position, leaning forward, drooling, garbled voice. This is epiglottitis. This is exactly what this is. They're drooling, they can't swallow. There's obstruction here somewhere. This is the one. Epiglottitis, you need to have some sort of airway tray in the bedside, a trach tray, intubation tray, because our airways are a big concern. A 10-month-old status post VSD repair is receiving AM medicines. 118/70, 99, 88, 22. What medication should the nurse question? Which one here doesn't seem right with those numbers up there? A 10-month-old. Again, go back and look at your vital signs for ages of children. So a 10-month-old's heart rate should be well above 100, and it's not. So that is the big deal. Vasotec and Alapril, they are commonly used. Furosemide is a diuretic, so that wouldn't be something that you'd worried about questioning it. And the other two, they're commonplace in children, but the heart rate is the big deal here. When assessing a newborn infant, you notice decreased femoral pulses bilaterally. What nurse action should be done next? So you get a newborn infant in, you're assessing, no pulses. What are you going to do next? What do you think this is? No femoral pulses, no popliteal pulses, no dorsalis pedis or posterior tibial pulses. This is probably coarctation of the aorta. So how do you diagnose it? Do a four extremity blood pressure, because blood can't go down to the lower extremity. The lower extremity blood pressures are low. Blood can't get there. But up top, that's where all the extra blood is going. So the blood pressure is higher. A multi. When educating adolescents about risk for HIV and hepatitis, what would you include? So HIV, hepatitis, the first thing is always going to be hand washing for anything. When we're talking HIV, hepatitis, we could tell an adolescent, please, abstinence. It doesn't mean they're always going to follow it. But again, condoms would be another thing that we would recommend. And I hope they take a shower more than every week. What discharge teaching would be needed for a toddler diagnosed with hemophilia? We don't always see hemophilia right at birth. Sometimes it's later on. So here we are, you've got a 1-year-old just diagnosed, they got hemophilia. It's all about now with that protect, right? We know hemophilia, you get an injury, it's rice. You raise it, ice it, contain it, and elevate it. But the teaching puts a P in front, that price, which is protection. That means patting furniture, patting the coffee table, or anything that could cut them. A multi. A child with hemophilia has fallen and the knee is swollen and painful. Treatment would include what? So the kid has fallen on his knee and now it's swollen. That means it's bleeding inside that joint. And that blood is causing irritation of the joint sac and it's starting to hurt really bad. What we do, just like we would for any sprain or break or anything, is rest, ice, contain, and elevate it. Absolutely. We're not going to exercise it. We're not going to put hot packs because that's going to increase that bleeding. Discharge teaching for a child with cystic fibrosis about respiratory secretion should include Cystic fibrosis needs a minimum of TID, CPT, postural drainage, aerosols to keep those lungs open and moving. That secretion is so thick and tenuous, it just sticks in there. So we need those aerosols loosening it up so that we can expectorate out that mucus. Your child with leukemia has had recent lab results with a platelet count of 10,000. Nursing action. And then I'll say any child that's in a hospital that you notice platelet counts of 10,000. What is your nursing action here? What's your concern? What does a low platelet count do? It causes bleeding. So you're going to place them on bleeding precautions. This is like ITP, right? No IM injections, and we're going to be monitoring those platelet counts. A child starts with a nosebleed for no reason. What action should you do first? So it's a thumb and forefinger to the bridge of the nose. Lean them forward. You don't want them back because they'll just swallow blood and they'll vomit. So lean them forward. After 10 minutes, if it's still bleeding, they need medical care. An 8-year-old semi-conscious boy is brought into the ER with blood sugar greater than 600, K6.8, low PAH, low CO2. What is your action? What do you do? What's your priority in this? That's DKA. What's treatment for DKA? You want to dilute that blood sugar and you want to decrease it as quick as you can. And you do that by giving an IV bolus of saline, no sugar do we bolus here at all, and start a slow, continuous infusion of regular insulin. Yeah, we'll be watching the potassium and all that stuff as we keep going, but priority first, fluids and insulin. A child is admitted with hypoparathyroidism. What findings would you see that need to be reported to the healthcare provider? What is the parathyroid and what does it regulate? Remember, the parathyroid has nothing to do with the thyroid gland. The parathyroid only works with calcium. What does calcium involve? Calcium, magnesium are both about muscle strength. So if you don't have enough hypo, you don't have strength in your muscles. As simple as that. If you had hyperparathyroidism, they'd be spasmed too hard, right? Same thing, all about muscles. A 2.5-year-old child, status post epispadias yesterday, wants to play. What would be appropriate? What's an epispadias? Do you remember? Epispadias, hypospadias is when the urethra doesn't come out the end of the penis. The epispadias is up on the top somewhere, and now they've fixed it. And they put a catheter in there to hold open the lumen so that we have it coming out the tip of the penis now. Now, we don't want them doing anything that's going to irritate their peritoneal area. And that would be riding a bike, riding a rocking horse, anything that smushes on that area. No, we do not. And we don't want them throwing and catching with hard balls or toys that could hurt them in the area that just had the surgery. So a nice puzzle would be perfect for that child. Color a picture, be fine. A child with Kussmaul respiration is due to DKA. The increased respiratory rate is trying to compensate for which acid base alteration? Well, what is DKA? Kussmaul's trying to do the opposite. It's trying to fix it. The body's pretty neat. It tries to fix itself. So DKA is metabolic acidosis. When we are starting that increased Kussmaul sort of respirations, you're trying to blow off the acid. That's metabolic alkalosis, but it's trying to compensate for the metabolic acidosis. When talking with an adolescent regarding personal health concerns, which is most important? So with adolescents, the one thing is to let them sit there and talk the way that they want and to be open and honest. Don't try to shut them down. Don't try to correct them. Just let them tell you whatever they want, and then you can help them with whatever decisions they got to make. In school age, conflict of industry versus inferiority. What does industry mean? It's my factory, right? It's my product. And it's that mastering a task. What do I do well? A multi. A child with a rash, fever, joint inflammation has rheumatic fever. Teaching should include what? So rheumatic fever has a lot of things that go on. One of the things that we cannot reverse is heart valve damage. Once it is damaged, it is damaged, and it's the mitral valve. Yes, it's caused by strep infection, and it does require long-term antibiotics. Contraindication to administering the varicella vaccine to an infant. This is a live vaccine. When would you withhold a live vaccine? Well, number one, if they're immunosuppressed, and number two, if you're on steroids, you are rendered immunosuppressed. Did you know that? That was always a question on med-surg that kept coming back. So I made sure I had it here in the PEDS course. Remember, any person on steroids is immunosuppressed. So getting a vaccine that's live, they cannot while they're on the steroids. Early detection of our hearing impairment is critical. Which one is of primary importance? So remember, hearing and speech are always connected. If they don't speak well, let's get a hearing test done. In helping a child to adapt to hospitalization experience, the best approach is, I think this especially goes to those toddlers and actually the younger preschoolers. They really don't tolerate being in a hospital. Keep them on a routine and they do so much better. Very good. When assessing vision on a child, the healthcare provider would use a Snellen chart at what distance? It's a health assessment problem, right? 20 feet, very good. And if they can't see, you tell the doctor. Referrals for cognitive impairment should occur when? When you're seeing delays. When do you report them? Early intervention cures so many things. So as soon as you notice. How would you help encourage a preschooler to be less apprehensive when taking their vital signs? Children, especially preschoolers, let them touch, let them play with the equipment. I would have them to push the button on the blood pressure cuff. I'd have them do me first, whatever it is, let them play, and you could decrease all that stress. What acid-base imbalance might you see with a child who's having profuse diarrhea? Remember, diarrhea is all your digestive enzymes that are being removed, and they're all alkaline. So what is left? And that's how you have to remember this. It's metabolic acidosis. You're getting rid of all the alkaline, so what's left? Remember, vomiting, you're getting rid of all the stomach acid. What's left? Metabolic alkaline, alkalosis, okay? I had one HESI that had 4 different acid-base questions. That's why I ask you these. A parent calls because their child is exposed to a child who now has chickenpox. When is she contagious? So children with chicken pox, they initially they don't know they have it. They didn't even broke out with a rash yet. It's usually 2 days before they break out, and then until all of the scabs are crusted and dry, which means a child who has chicken pox cannot go back to school until all of the lesions are crusted and dry. What is the nursing priority preoperative intervention for a child with Wilms tumor? Wilms tumor, remember this is fragile. They do not even do a biopsy preoperatively because of the amount of metastasis that occurred just by entering it. A multi. If an infant is not past the meconium stool in the first 24 to 36 hours, what would you assess for? I've mentioned this meconium ileus quite a few times, this term. Which ones here? It's everything but electrolytes. Electrolytes don't have anything to do with stool being formed. But Hirschsprung's, that's a megacolon. That's a bowel obstruction. Cystic fibrosis, it's going to show you. Could do a sweat test. Hypothyroidism, no stool. We're going to be doing thyroid blood studies, and then we can catch it at birth. A child with sickle cell disease would most likely exhibit what sign and symptoms of a crisis? So, sickle cell children, when they come in, their biggest complaint is pain. Now, we know sickle cell disease is usually due to small blood vessels. Many times it's due to dehydration, just to let you know. But they come in, their symptom is pain. They hurt, they're crying. When teaching the child and family about celiac disease, which one of these food items is allowed? And we can give rice. In fact, we encourage rice, rice flour, rice bread, rice whatever. Rice is a great alternative for that child. A child stepped on an old nail while playing outside. What action should the nurse do first? First of all, you want to clean the area. If there's something trying to enter it, some tetanus, trying to get into the body, let's clean it with soap and water, put an antibiotic ointment on it. Now, yes, they will be getting a tetanus booster. Sometimes they even put it around the area of the puncture, depending. So it's a choice sometimes. But washing it, soap and water, and putting on ointment. A 6-year-old child goes to the ER due to abdominal pain and fever and vomiting for the last day. What assessment's priority? As in, what do you need to know? You need to know where is the pain. If it's umbilicus or it's epigastric, that's not an emergency. That's usually gastroenteritis type stuff. But if it's right lower quadrant, that's an appendix. It's something that needs more priority of treatment. Okay. A 5-year-old child fell off from the monkey bars and is crying because of pain in her arm. What action should the nurse do first? What is our biggest concern about an arm that might be broken? And you always initially are concerned about capillary refill. Remember, anytime there's bruising, there's a break, always distally checking neurovascular signs. Are they doing okay? And of course, besides that, it's the rest, it's the ice, it's the contain, it's the elevate, but we got to make sure there's blood flowing. What is one way to help detect hypo or hyperthyroidism in children? And I've said it 100 times this term, one of the biggest reasons why we always do height and weight on children. As you become an adult, they don't care how much you weigh anymore, do they? But as children, we really do. What would be the most important to report to a healthcare provider for an 8-year-old status post appendectomy with NG tube dissection? An NG tube dissection. Right here, which one of these is the one that you're concerned about? NG tube output, that's not bad. Urine output's what it should be. Pain scale, yeah, they just had surgery. But look at that neutrophil count, guys. Remember, 500 and less, they have absolutely no immune system. That child is in trouble of becoming septic. So that is your priority. I mean, we said, oh, NG tube suction, it might be something to do with that. Nope, neutrophil count, know that one. A multi. Signs and symptoms of hypertrophic pyloric stenosis. Hypertrophic pyloric stenosis. Whenever I get these infants in, remember, ages 3 weeks to 3 months, my first question is when they're vomiting, is it dribbling or is it across the room? If it's across the room, I take my hand and put it underneath the xiphoid process, and I'm going to feel that olive size mass there. So diarrhea, nope, nothing goes down, so nothing comes out that way. And they keep eating and vomiting. They're starving, they're hungry, they've got a great appetite. They eat well, but it doesn't go down, and they projectile vomit it. A multi. A child with chronic kidney disease has renal osteodystrophy. What outcomes would you see? What does osteodystrophy mean? So osteodystrophy is all about bones and lack of vitamins and crooked bones, short bones. It's all about that. And bone pain is something that we do see in chronic kidney disease. You suspect an infant has cryptorchidism. How would you examine the infant? What's cryptorchidism? You've got a child, their testicles are up inside the abdominal cavity. So we know men, when they're warm, their testicles will hang a little bit more. When they're cold, they tend to suck in. So how are we going to get a good examination? Have them in a warm room so that they can hang as well as they can to make sure that we get testicles in the scrotal sac. I'm all dying. What teaching would you give parents on how is a hypospadias corrected? Hypospadias, epispadias, same treatment. Hypospadias, the holes on the bottom of the penis. Epispadias is on top. But always we're trying to get that urethra out the tip of the penis where it should go. So remember with this surgery, epispadias, hypospadias, we need the foreskin. We need it for plastic closure, okay? That stent's placed there 7 to 10 days. We don't touch it. We just keep it inside a diaper so it doesn't urinate out. And this child has his penis filleted open. It is not local anesthesia, general anesthesia. I mean, the penis is filleted wide open. You're not just going to numb the area. Furthermore, you never put numbing stuff in the tip of anything because it decreases blood supply. Whether a penis, a finger, a nose tip, doesn't matter. We don't put it there. Almost dying. Children with nephrotic syndrome are often given albumin and Lasix for fluid overload. What outcome would you want to see if they were given that? So albumin is another word for protein, right? And nephrotic syndrome is all about swelling children and getting rid of protein. So let's replace that protein in the blood, and it sucks out the fluid from all the interstitial tissue. And then we give that furosemide, that Lasix behind it, and we are going to see that urine output come out really well. And of course, edema's going to go away, and your blood pressure should go down with it. What lab value on one of your clients makes them a priority to see them first? What lab value here is concerning to you guys? There's a couple here you might say. The big one here, the neutrophil count. Child has or adult has absolutely no immune system. They are about to go into septic shock on you. Multi. An adolescent BMI of 90% is complaining of frequent urination. What tests can you anticipate the healthcare provider doing? What do you think might be going on? Adolescent, they are overweight and they're urinating a lot. So you're definitely just going to look at the urinalysis. It could be a simple urinary tract infection. It could be diabetes. A hemoglobin A1C would be a good thing. And because you're urinating a lot, you're losing potassium. So absolutely, let's check that. An X-ray is not going to tell us anything. What teaching should be done for an adolescent with Hodgkin's lymphoma getting chemo and radiation? Hodgkin's lymphoma, that's that big Hodge, the lodge. It's that cervical big nodes that we do. And we put radiation in there and then we shrink them, give chemo, and we usually do surgery there too, right? Our biggest concern in Hodgkin's, non-Hodgkin's, is infertility. With the radiation and chemo, it's a double dose, and many of them end up that they can't have babies. A child falls in a thick bush and he's covered with prickers and is complaining of severe eye pain. What do you do? What's your intervention? Priority, what do you do? So anything in the eye, we never remove it unless it's floating. We can get it out. But if it's sticking in there, you take this Fox Shield, it's called. It's a hard patch. Put them on both eyes. Get them to an ophthalmologist or get them to a pediatric ER that can take care of it. A 2-year-old goes to the ER with inconsolable crying and a painful abdomen. What findings show you this is a medical emergency? Painful tummy, 2-year-old toddler. Classic intussusception is right there. And in intussusception, it's current jelly stools. You know, I have children, and it's like sudden onset of pain. And if you put your hand on their tummies, it's rigid, it's stiff. If you look inside their diaper or even their underwear, you might see a little bit of current jelly looking stuff. You might have little blood streaks in it. It's that intestine sort of pushed it when it sucked into each other. When assessing a 2-month-old with vomiting, which question should you ask the parent?
Are you breastfeeding? What did they eat last? It's not 2 months old. Or
2 months old. We've got to make sure we're not overfeeding that child, aren't we?
What's the answer?
So this child here are they burping well? Okay, that's a big thing. Are they sitting up afterwards? How much are they eating? Are you overfeeding them? But the big thing is initially, are you burping them? Are you sitting them up? And then you go into more of how much are they eating and making sure they're not overfed. You notice a 2-year-old with congenital heart disease that the heart rate is decreasing. What other information is important to give to the healthcare provider? So congenital heart disease, their heart rate's starting to get slower and slower. What else is this doctor going to need to know? And that blood pressure, that's very low for a 2-year-old. 80 over 60 would be more of a 2-year-old, or 90 over 60. So again, knowing what that blood pressure, that's a newborn's number. What priority procedure will you anticipate for a child suspected of having Kawasaki disease? What do you need to do first on these kids? What is our biggest concern about Kawasaki? Multisystem vascularitis, right? But our biggest concern is that coronary artery aneurysms. And we figure that out, we do an echocardiogram. That's the first thing we want to do, is that aneurysm there, because we need to go to surgery and get rid of it if that's going on, because it will burst. A multi. Why do we give aspirin therapy to a child diagnosed with Kawasaki disease? How do we treat Kawasaki? It's a virus. We give IVIG and aspirin thins the blood, prevents clots, and it's also doing anti-inflammatory. A multi. What lab test should be monitored for a child with congenital hypothyroidism? T3, T4, TSH is what we do. Growth hormone is pituitary gland. Luteinizing hormone is growth hormone, which is pituitary gland. So none of those. A multi. When entering the room of a child, the child becomes stiff and the arms and legs start shaking. What do you need to do? Priority. What do you do? What's going on? Having a seizure, right? So what do you do for a seizure? So again, get somebody to help you, turn them to the side, know what time it is, clear the area, pad the side rails, put them flat, and be ready. A 3-year-old boy with a waddling gait and falling is admitted for testing. What procedure would you anticipate? What do you know about 3-year-olds that could be waddling and gait? What's one of those diagnoses I talked to you about? And that's Duchenne muscular dystrophy, waddling gait. So if we are considering this muscular dystrophy, we're going to do that electromyography. We're looking at muscle strength. Remember, these children, when they come back, feel like they ran a marathon. Make sure you have some ibuprofen or some Tylenol for them when they get back. A mother calls the clinic about her child. She was playing in the woods and has a rash that's spreading. What over-the-counter medicine is good? What can I use on this kid? Mother called you at the doctor's office. And we're not going to tell the mother to give anything. They need to get treated. We don't know if it's a rash, poison ivy, or if it's some infectious disease. We don't know by a phone call. A mother calls the clinic. A friend of her child has ticks from playing in a field. What do you tell the mom to do? Well, my friend's kids had ticks. What am I going to do? My kid was with them. And all you do is get them naked, check them head to toe. Absolutely. What shouldn't you do with a child diagnosed with impetigo? Impetigo is a really bad skin staph infection. My little Christian had it up the back of his leg, and let me tell you, it went little bit and it went the whole back of his leg very, very quickly. We put topical antibiotics, we give oral antibiotics, and you need to get those fingernails cut really, really, really short. Okay. And that's what we do with it. Now, they don't want you, there's like a little juice fluid inside these little pustule things. If you open it, it spreads it. That's why they don't want you to open it. An adolescent goes to the school nurse with complaining of ringing in her ears. What exam should the nurse do? What do you do first there? You're complaining of ringing in the ears. You're the school nurse. Number one, go and look first. I've actually seen beetles and bees and ants inside ears alive, making noises. So look in there first. A multi. An infant is being discharged after 14 days of vancomycin. What teaching should be included? Well, vancomycin, an aminoglycoside. What are you worried about? That's a really strong antibiotic. And I know they're concerned about side effects here. So what are you concerned about? Ototoxicity and also nephrotoxicity. Make sure they're urinating and they're still hearing. And last question, a multi. When checking the lab values of a child with hypothyroidism, what lab values would you look at? And it's T3, T4, TSH. Yes, yes, yes. We did it, guys. Good job. Diana, good job, Diana. Number two. Lizzie, good job, Lizzie. Number one. Eli, good job, Eli. Four. Bailey and Alexa. So you guys made it through the 100-question Kahoots. I'll be posting this up shortly for you. Know that there's still homework this week. Don't forget it. It's still worth quite a bit. Anybody who needs anything, let me know. Tomorrow I'll be doing it 2 o'clock, that HESI review, and I will send it up for you. Anybody need anything?
Ms.
Thanks, guys.
President,
Yes.
when will the exam grades be posted?
Right after 6 o'clock tonight.